Hello, my name's James. I'm one of the chiropractors here at Lushington Chiropractic, and I'm going to talk to you today about how we test the nerves, particularly the nerves that come out of the neck into the upper limb or the arm. So I'm going to show you today with Eve. Thank you for helping us, Eve. Lovely. So one of the first things we do in a nervous system exam is have a little look. So there might be muscles that are twitching, flickering. It can be incredible. They look like little earthworms under the skin. That's called a fasciculation, and that will be telling us that the nerve is pinched, something called a lower motor neuron lesion, easy for you to say. So sometimes you might see those moving under the skin, and relax for me, Eve. And sometimes the muscles are wasted, particularly the muscles here might be wasted. And again, that gives us clues as to where the nerve is damaged or which nerves are damaged. And if the muscle isn't getting any information, actually the muscle can start to waste away. It's very serious. You might also see someone might be holding their arm in a particular position, or it might be stiff, or they might have a tremor. So those give us more clues as to what might be going on with the nervous system. If there's a tremor, we're interested if the tremor is when they're resting, or if the tremor comes when they're trying to do something with their hand. So there's a difference between a passive or resting tremor, which is more common, say, with Parkinson's, or if there's an active tremor when they're trying to use their hand to do something, which may give us indications of a lesion or a problem in the cerebellum. And let's be clear, chiropractic doesn't treat those problems, but it's important we understand the full health history and the full condition for this particular patient. So first of all, with any assessment, and certainly a neurological assessment, we're making an observation, we're looking at that. So the first thing I'm going to test is sensation. I'm going to use this piece of equipment. We call it a pinwheel. As you can see, it looks pretty mean. I'll demonstrate to the patient because it could be scary. So what I'm going to do, Eve, I'm going to run this over the skin. It is a bit scratchy. All right. I want you to tell me if there's any obvious difference from one side to the other. I'm not looking for very minor differences. I want to know if there's an obvious difference. So you'll know if there's a difference one side to the other. Put your hands on your thighs, either side, and I'll run this. Typically, the patient would be undressed, so I can check up through here. This is an important part of the arm. I'd normally want to check sensation. So I'd never do this through the clothes. But let's compare here to the other side. Thank you. And we're going to check down here, and then the inside of the arms, any obvious difference side to side. And I'll check down on the fingers. And we'll check the little finger, the middle finger, the thumb, and the same on the other side. Any obvious difference, one side sharper or number, or all about the same?
All about the same.
Brilliant, thank you very much. And sometimes people will come back and say, well, that one is sharper, or that one feels a bit duller. And again, I need to put that together with the history and the rest of the assessment to tell me if the nerve is affected, which nerve, where is it affected, and how is it affected. It's not automatic that it's numb, so that's the side that's the problem. It could be the other side is extra sensitive. So we've checked pinprick. I always like to compare that with a different type of sensation, with vibration. And the best way to check vibration is with a tuning fork. All right. So we're going to pop this tuning fork on the bony areas, on the elbows and on the fingers. And again, I'll ask Eve, this is an obvious difference side to side. All right. So I'm going to pop this up here, Eve, and on the other side, tell me if there's an obvious difference. If one side is number or one side is stronger. All right. If they're about the same, don't worry, just let me know. So any obvious difference one side to the other?
That one seems duller on that side.
Okay, let's check around your elbows as well. Pop your fingers up for me, please. Good job. I'm going to check here. Little fingers, any obvious difference side to side. But we're checking sensation in at least two different ways. One is with pinprick and this one which is vibration. There are actually different types of nerves. So the pinprick are testing your pain nerves. That sensation is called nociception. And those nerves are thinner, they're smaller. And this one is testing soft touch or vibration movement. Those nerves are fatter, and actually this information will travel in quicker. The reason I mention that, I don't know if you've ever noticed it, if you banged your elbow and then you rub it, okay, that rubbing will numb the pain. So you bang your elbow and the pain is signaled up those nociceptive nerves, those pain nerve fibers. If you rub it, those movement fibers come up in a similar pattern and they block the pain. The body has evolved like that. Every time we move a joint, pain information is signaled, but also movement information is signaled. And so if everything's working properly, you don't feel pain when you move your elbow because the movement information gets there quicker, faster, and blocks the pain information. But sometimes those pathways get confused, and any movement, if you've had flu and you think, oh, every time I move my joints, it's achy. And so sometimes those pathways get confused and your pain pathways get extra sensitive. Those are all the things we're taking into account when we're doing our assessment. So we check sensation. We're going to check reflexes. So reflexes will test sensation because the information goes into the spine That causes a reflex, which causes a reaction through to the muscles. So a reflex is a useful way of testing sensation and the muscular system to make sure that both parts of that circuit are working well. So I'm just going to take this hand. Thank you very much. Relax your arm for me, Eve. Drop down. You try not to hit the patient. You try and hit yourself, hit your thumb. So Eve, I'm just going to hit this area here with a hammer, if that's okay. I want you to relax as much as you can. Fantastic. And you can typically feel that with a patient. All right. It's not painful at all. Here we go. Good. You can see that slight reflex coming through here. Let's change that slightly. Thank you, Eve. Good. And we're going to do the same here on the back of her forearm. Now, unfortunately, this time I am going to hit Eve. It's nothing personal, but I want to get different muscle fibers, and my thumb is probably a bit too big. Okay. Good job. So as I hit those, you might have seen different parts of her finger reacted. We're now going to check and relax for me. I'm going to go back and check her bicep a little bit more. And relax her shoulder. Good job. There we are. Okay, so the bicep is reacting a little bit. And we're going to check tricep through here as well. Good job. So we're getting a nice response there too. It's not simply a yes or no answer. So sometimes with a reflex, it's too brisk, it's working, but it's too strong. Again, that gives us clues as to where those nerves might be damaged. Sometimes you can get a reflex in it and it kind of vibrates. You actually get a rebound reflex. Again, that gives us information as to how the nervous system is working. And you can get situations where you do it and there's no reflex at all. Sometimes that's practitioner error. So we need to get better at what we're doing. Sometimes it's because the patient's too nervous and they're tense. But actually, sometimes it's because the nervous system, the reflex isn't working. And actually, with experience, you can hear that. Sometimes when you take that reflex, nothing happens, and you can hear it sounds different as well. We check sensation in two different ways. We then check the reflexes, which check the sensory pathways and the motor pathways. And we're also going to do some specific tests now to test the muscles, which are called myotomes. So myotome is a group of muscles that are supplied by the same nerve root. First of all, we're going to check the deltoid muscles. So if you bring this arm up to the side for me, Eve, that's excellent. So I'm going to try and push down. Don't let me. All right. Hold as strong as you can. Hold. Very good. And relax. Bring your elbow to your side. Make a fist for me, please. Try and pull your thumb up to your shoulder, as strong as you can. Hold. Good. Try and push your hand down to the floor, as strong as you can. Hold. Try and push your wrist back. Hold. Try and pull your wrist forwards. Excellent. Fingers out straight. Squeeze onto my fingers for me, please. Hold strong. Don't let me open them. Hold strong. That's it. That's great. Fingers out straight. Don't let me bend them. Hold strong. Good. Fingers out wide. Don't let me push them together. Hold strong. And relax. Good. Now with some of those tests, if I really wanted to, I could win, but I'm looking to see if those reflexes are working, or sorry, the muscle strength is there. So I'm testing, not really how strong Eve is, but I'm testing to make sure the muscles are all ready to go. And like all the tests, so sometimes we might find something is weaker. It doesn't automatically tell us the answer. So if it's weaker, it gives us information. The mistake you can fall into is going, hang on, that muscle's weak, it must be a trapped nerve. Well, no, sometimes the muscle is weak because the muscle is sore, the muscle is painful, or the patient is nervous, or when I'm testing this muscle, it hurts their neck, and so they stop responding. So what you've got to do as a chiropractor, you've got to think about all of that information and think, well, why is that weak? Does that make sense? And if it doesn't make sense, can you test it in another way to make sure you're really getting the answers you think you are? With those myotomes, we test them and we grade them from 0 through to 5, 5 being full strength with resistance, and then they're graded going down from there. I talked about myotomes, each group of muscle that comes from a particular nerve root as it comes out of the neck in this situation. But actually, when those nerves come out of the neck, they all intermix and they all join together through groups of nerves. Typically from the history, you've already got a bit of an idea of where the problem is. You then use your examination to clarify that. I'm going to ask you to sit up tall, pop your hand out in front. Excellent. And the very tip of that finger, I want you to touch on your nose, but I want you to do that with your eyes closed for me, please. As accurate as you can. Excellent. And arm straight out again. Good. And drop your arm down. So I'm looking there to see if there's any tremor, any shake. You might remember I talked about that at the beginning. One of my favorites, because of the word is so long, I'm going to check how quickly and how coordinated you are at moving your arms. So just copy me. Keep your elbows at your sides, palms up and down. Keep going and keep with me as fast as you can. Good, excellent, really good. It's like jazz hands, isn't it? And that is testing how quickly Eve can coordinate that movement, maybe how rigid, how stiff the muscles are. And sometimes people go, hang on, you can see they're really trying and they can't do that. And again, that gives us some more information about problems with the nervous system, but particularly to do with the cerebellum and up around the brain.